Telemedicine has a very important role to play also in Nigeria, especially in the rural areas. But unfortunately, most of the telemedicine that is obtained at this point is primarily in the urban areas. You know that there is this disparity, significant disparity between the urban and the rural area, especially in sub-Saharan Africa and in particular in Nigeria, because a lot of education needs to be done to make people understand. You see, the truth of the matter is that we really need to go back to the drawing board. While we are trying to adopt technologies, we also need to go back to the drawing board and see how we can actually sensitize our people. How do they get aware? How are they able to accept the fact that cancer treatment is not a treatment that is primarily local? In other words, if you are coming from my area or from my village, to be precise, a lot of people don't even want to go to the hospital because they believe that, as they call it, chiu and daji, is not for the hospitals. So whether you're doing telemedicine or whether you are, sending all sorts of technologies, first the patient must accept that this is something that you need to go to the hospital and get treated. Yes, I know that there are quite a number of telemedicine that have made progress in Nigeria, like Mobi Health, I know is one of them. Oncopadi is another one. But the reach, especially when you look at northern Nigeria, for example, where you have, so many people in the rural area who are really, really poor and have not taken, healthcare as one of their privileges, it has not penetrated. And in all honesty, we haven't seen the effect really of technologies, telemedicine, and what have you. There are so much things that can be done, when you talk of telemedicine, not only for breast cancer, but even for other cancers. I'll give you an example of how you can actually manage cervical cancer using telemedicine. I went to Zambia, and there was this guy who has, gone to all the primary health care in rural Zambia. And what he does is that he trained the community health workers to examine the cervix of the women and take pictures, and then send those pictures to him real time. And then he, as a pathologist, gynae oncologist actually, look at them and said, this one needs to be re-examined, this one is fine, and so on. So with that, he was able to screen over 200,000 people from the rural area. And these are the kind of things that we really need to replicate also in Nigeria. So yes, telemedicine can help a lot, but most of the telemedicine that is being conducted are primarily by people that have NGOs with not so much resources. I will want to see, for example, NICLAT unleashing telemedicine across rural Nigeria, because that is where the burden is. We don't even have the statistics. You see, when you talk of in Nigeria, we have this, in Nigeria, we have this. These statistics are primarily from urban areas, Lagos, Abuja, Enugu, Port Harcourt, and that is it. You don't hear the statistics coming out from the rural areas. And believe me, I know that by the time we unleash the gamut of telemedicine that we can have in this country, you'll be so shocked that even the statistic that we have of cancers, especially breast cancer, will be just the tip of the iceberg.